Healthcare in Newham. It's here for you. Everybody needs to see a doctor or get advice on healthcare at some point. If you are unwell or have any health concerns, there are a number of ways and places to get health information, advice and treatment in Newham. Pharmacies, Newham Urgent Care Centre, Accident and Emergency, and local doctors. It is very important to be registered with a local doctor, and we will tell you how to do that in a moment. But first, we will show you where to get immediate or emergency health information, advice and treatment. If you or someone in your family is feeling unwell, you can get health information and advice from a nurse by calling NHS Direct on their confidential 24-hour phone line every day of the year. You can also visit the NHS Direct online website for health information. Your local pharmacist, usually found on the high street, can give you information and advice and provide you with medicine for minor ailments such as sore throat and high temperature. They can also advise you on medicines you have been prescribed by your doctor. You can get access to healthcare advice and treatment for minor injuries and illnesses at the Newham Urgent Care Centre, located at Newham University Hospital. Anyone living, working or visiting Newham can go, and it is open long hours every day of the year. You don't need an appointment, and assessments are carried out by experienced NHS nurses. Accident and Emergency, or A&E departments, are designed to treat accidents and emergencies only. An emergency is a critical or life-threatening situation, which may include loss of consciousness, severe chest pain, loss of blood, or a mental health crisis which requires urgent medical care. A&E is based at Newham University Hospital and is open 24 hours a day, every day of the year. For your everyday health needs, you need a local doctor, who are called general practitioners or GPs. They also act as gatekeepers to the rest of the NHS and can help you get to see other health professionals, such as specialist doctors at a hospital or maternity and children's health services. Many GP practices, which are also called surgeries, employ other highly qualified health professionals to undertake a range of health checks at the surgery. If you need to see a GP, you need to be registered with a GP practice first. Newham has 133 GPs working in 66 practices across Newham. You should register with a GP surgery near where you live by phoning or visiting the practice. If you have difficulty or need help to find a GP to register with, you can contact the Find a Doc service by telephone or email. They can send you a list of GPs in your postcode area, as well as dentists who accept NHS patients. To register with a GP, the surgery will ask you to provide proof of address and proof of identity. The type of proof of address that practice is asked to see varies from practice to practice. It can include a utility bill, like gas or electricity, a mobile telephone bill, a bank statement, a rent book, or a new entrance scheme letter of introduction. The type of proof of identity that practice is asked to see also varies, so you need to ask the practice for a list of documents that they are willing to accept. But you should know that you are not required to show official documentation such as your passport or immigration papers. So if a practice asks to see such documents, you can choose to say no and try to register at another practice. You will also need to attend a pre-registration health check, usually conducted by a practice nurse. You will be asked about your health, and they will record your height, weight, waist size and blood pressure. You should take any health records that you have with you when you register, like vaccination or immunisation records. If you need to be seen by a GP before a pre-registration health check takes place, you can still ask to see the GP for what's called immediately necessary treatment, but you can only access this type of appointment if the medical condition requires urgent treatment by a GP. Once you are registered at a practice, you will be given a practice leaflet that tells you the opening hours and range of services provided at your surgery. And if you need to see a GP, practice nurse or other health professional at your surgery, you will usually need to make an appointment in advance, rather than just turning up. You should be able to see a GP at your practice within 2 working days, or on the same day if you're unwell and it is urgent. You should also be able to book an appointment up to several weeks in advance with a GP of your choice, if you wish to do so. If you need to contact a GP and your surgery is closed, there is a GP out-of-hours service you can call. If you telephone your surgery when it is closed, you will either be automatically transferred to this out-of-hours service, or an answer phone message will give you the number to call them direct. If a practice refuses to register you, they should set out the reasons in writing for you, including contact details for our Patient Advice and Liaison Service, PALS. This service provides confidential, on-the-spot advice and support and can help sort out problems quickly. You can also contact PALS to raise any other problems or concerns you have that relate to local health services. If you don't have a permanent address, or you can't provide proof of identity, and are therefore unable to register at a practice near where you live, the Find a Doc telephone service can give you up-to-date advice on how to register at a transitional practice. Your health is important, and remember, all patients should be treated with dignity and respect by all health professionals at all times, and consultations are confidential. Find out more about healthcare in Newham.